Colin Hung here for Healthcare IT Today, and I am here in rainy Vancouver for the eHealth2024 conference, an annual event that is Canada's equivalent of HIMSS. I always love coming to this conference, A, because it's an opportunity for me to come to Vancouver, which I don't get a lot of chance to, and B, and more importantly, it gives me an opportunity to hear and see all the incredible innovations that are happening in Canada in health IT. If you're doing anything innovative, this is definitely the conference that you need to be at to showcase and to tell people about it. And for me, that's really the big takeaway of this conference, is Canada is doing some really incredible things when it comes to AI, when it comes to the adoption of RPA, RPM. We're doing a lot of really cool things with care at home. Canada is known for being a land of pilots, and I can say we're living up to that reputation. I've heard a lot about these fantastic pilots that people are doing with ambient clinical voice, with doing some really innovative population health initiatives, with doing some innovative patient experience programs and connecting patients and doing patient co-design. It has just been so heartwarming and so brain-filling to hear about these particular projects. Now, in terms of some trends, of course, the number one trend here, AI. It was everywhere. There's been a lot of talk about how Canadians can adopt it, how practices, how hospitals can adopt it. Definitely the hot topic of the moment here in Canada as well. But one of the more interesting trends that I noticed here in Canada and at this eHealth conference is that there are a lot more Americans up here. And that is a welcome trend. I know some of my Canadian counterparts will say, that's it, Colin, no, we want our homegrown solutions. But I actually think that the fact that other companies from outside of Canada are taking an interest in the Canadian healthcare market is a good sign. It means two things to me. One, it means that people are recognizing that the Canadian market really isn't that much different than others. B, that the problems that Canadian healthcare organizations are facing are no different than a lot of others. And to me, that's actually a good thing. We're not that unique. And third, I think it will help spur further innovation and accelerate that. Nothing better than competition to spur people to improve at a faster pace. So I like the fact that companies like Harmony Healthcare IT, that Zebra and others who have been here for a long time are coming and doing more investment in Canada. And actually, I have to say, that has been one thing that I've forgotten about. There are a lot of companies here that I'm used to seeing in the US, like Zebra, Altera Digital Health, and I've forgotten that they actually have legacy in Canada. They actually have a lot of investment. They have local offices, they have local people that they've hired. I mean, Meditech is a great example of that. They have a lot of people here that work in Canada and service the Canadian operations. So, you know, I think it's just great these organizations are here and they're supporting and investing in Canada. If I was to say one thing that I'm looking forward to next year, other than the fact that it's actually going to be in Toronto, in my hometown, and that is I'm really anxious to see how some of these pilots are going to turn into something real. And that's one thing I think that's true for healthcare conferences everywhere. We do a lot of talking. We talk about interoperability. We talk about patient experience. It's time to deliver. And so I am hopeful that the Canadian folks here that presented will be able to report back 12 months from now on some of the amazing initiatives and how they're really making a difference for patients, but more importantly, how they're actually scaling it and deploying it in multiple places beyond that pilot. So, hey, if you weren't here at eHealth Canada, eHealth 2024, I hope you can come next year. It is in Toronto, and the year after that, I'm super excited about this, it's going to be in Halifax. It's definitely worth coming to check out, and definitely worth investing in the Canadian healthcare and digital health market. Now, while I was here, I did have the chance to connect with a lot of companies and a lot of representatives to ask them questions about some of the projects that they're working on, and so I'm going to let them tell you some of those exciting things.
AI specifically, especially in healthcare, and some of the projects that we're involved with are really quite gratifying actually, where we're able to see some material impact for patients. One of our customers are able to, it's a children's hospital, and what they're able to do is as the kids come into the acute care ward, they're able to receive all the sensory data, put that data against, because now data is looked at as a more of a platform and as opposed to individual silos that's been traditionally the case. because it is a more of a platform view of things and looking as storage as a pool rather, they're able to pull, compare that sensory data against this bigger data set and allow them to do things like predictive medicine, where they're able to, already they can predict renal failure and if the child's going to go through that, or if there's cardiac arrest in an OR, and they can do predictive medicine, or the goal is to create predictive medicine such that they can help a doctor understand and diagnose what's wrong with that child before and accelerate that healing process, right?
Yeah, well, in Manitoba, as I say, we're looking to be a provincial partner. Altera and Manitoba together partner. We've got DB Motion and Sunrise. We're pulling in data from across the province from hundreds of different downstream systems. So you're getting that single view. They're doing a lot of awesome things with DB Motion in Manitoba. Also here in Fraser, we've got Meditech Expanse, Legacy Meditech, Paris Mental Health, their provincial lab system, and we're pulling all that data in and giving that single view to the clinician. We're implementing our agent project, so our agent, DB Motion agent. So yeah, we've got a really good in-depth customer, deep relationship with our partners here with DB Motion in Canada.
So when I'm talking to CMIOs and CIOs lately, the biggest trend is around the adoption of ambient technology or AI scribes to reduce that administrative burden for clinicians. Like the technology is invisible, we're not staring at screens anymore, we just speak to patients and everything's automatically put back into the EMR in documented format. I think what's neat is that it's been mostly happening in the US, but recently I'm hearing it actually get adopted in Canada. So Oracle's coming out very soon with their digital assistant. The Ottawa Hospital has been the first in Canada to adopt Nuance's DAX Copilot. Even in Ontario, the Ministry of Health is now funding pilots of ambient in clinics. So a lot happening across North America. Yeah, I think the other thing, this is me being biased, but I think we're seeing device-based remote monitoring transition to more of I call it deviceless remote monitoring, where you can actually provide digital care to not just the 5% of patients with heart failure and COPD, but with a software-focused approach, you can actually get remote patient monitoring to surgery, oncology, palliative. That's what we really focus on, and we're seeing that adoption grow quite really high the last couple of years now.
So with Traverse Exchange Canada, we've really emphasized an interoperability strategy. We've created this network where we can share and exchange patient data. In particular, at present, we're exchanging patient summaries, known as the CCD. We really built that on the foundation of what was done in the States for a lot of years, but bringing it up here so our hospitals, our organizations can share that data. And under Project Amplify in Ontario, we also wanted to bring along the point-click care or the long-term care facilities. We have more than 400 our hospitals are connected to more than 400 long-term care facilities right now. So we are truly exchanging data with acute and long-term care facilities, which has been really remarkable. We've done this in about 1 year's time, and it's really taken off. We're delighted where we are. So it's really a hub and spoke methodology, and on the spokes, we would call that the federated model, where data resides in the original source, and we're a pass-through opportunity. So if a patient was to visit a hospital or an acute setting, or to be transferred out to a long-term care setting, we can reach to those sources and serve that up. In our hub, we have a record locator service, so we know where the patients have been, and we can serve that data across. Really pass-through opportunity. And it works better. I think keeping that data in that federated model is a nice way to handle the data sovereignty, if you will.
Now, I have to give a shout out to the organizers of eHealth2024. It has been a very well-run conference. I know there's been some issues in terms of the size. The conference actually sold out because they reached the fire code capacity of this facility, which I think is a great sign. But more importantly than that, they really tried to be inclusive here, and they really tried to include patients, which I commend them for. So there was a patients area where the patients were in, where you could go and connect with and talk to patient advocates who are all doing some amazing work here in BC and in Toronto and other places. So that was really good. And just the amount of networking that was available at this conference really stood out for me. So kudos to the organizers over at the eHealth 2024 conference. You guys did a great job. It has been fantastic to be here. Now, one of the people I really enjoyed interviewing was Rob Fox. He's the CEO of Altera MD. Last year at this event, I had the opportunity to sit down with Rob to talk to him about some of the new initiatives, and he kind of leaked that he was doing some stuff with AI. And so I really wanted to find out here what he's doing, and here's a little snippet of some of the stuff that he's achieved over the last 12 months.
But it's really important for us to really look at the opportunity for AI Scribe and define the problem. And the problem is, how do we support physicians in the administrative burden that they're facing in terms of the burnout that they're getting from spending all these hours, they're saying up to 19 hours per week per family physician, in terms of the amount of time they're taking documenting. So back in October when we last discussed, it was around how do we use these tools to listen using ambient technology of the exchange between a physician and a patient to automatically, through AI technologies, capture that interaction and assemble that information into notes that physicians require. So it's all automated and physicians save a lot of time. They still have to check the output, but it saves so much time. And since that time, we've done a lot of activity with physicians and with various providers of these solutions. So what we did first was had a small group of physicians adopt the technology, test it, and we did a deep dive into what is the true value proposition of these tools, and remove the rhetoric that many vendors have around, it saves this, it does that. We wanted to test that for ourselves, and we had incredible results. In fact, many physicians are saying it's bringing the joy back to medicine for them. It's saying that they want to stay in the business longer of helping patients. That it's saving them incredible amounts of time to spend with their family or see more patients.
So, as I wrap up another eHealth conference here in 2024 in Vancouver, BC, I'm going to have a couple of really important takeaways. Number one, definitely need better rain gear to be here in Vancouver during the spring. Second of all, Canada is definitely a place where innovation can happen in healthcare, even though we give ourselves a hard time that we're very far behind and we're very slow to adopt. And although those things are true, it doesn't prevent us from trying some new and innovative things. We tend to take a little bit longer, but we eventually get there. And number three, just being here just reminds me of all the passionate people that work in the Canadian healthcare ecosystem. We've seen government officials, we've seen health IT people, we've seen people who are heads of associations, and we've seen patients here really get involved and force their voice to be heard, which I find very encouraging, very important. I think the last takeaway for me as well is that, hey, the Americans are coming. So if you're a Canadian health IT company, don't see this as a threat, see this as an opportunity to improve your product, and hey, turnaround is fair play. So if you're a Canadian company listening to this in health IT, it's time for you to go down the US and showcase some of that Canadian know-how south of the border. And hey, if you enjoyed this video and as much as I enjoyed making it, please like and subscribe. Also head on over to healthcareitttoday.com where you can find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.